What's next for AstraZeneca's COVID vaccine? Here in the U.S., the pharmaceutical company's vaccine still has not been approved by the FDA. When could that happen? Matt Gregory from our Verify team has the latest.
It's been quite the wait. We saw 3 vaccines approved and rolled out back to back to back, but then AstraZeneca, which we've heard about for months, still no approval yet in the United States. What gives? We asked the experts and they said it's a combination of timing and caution. Tens of millions of doses of AstraZeneca's vaccines sit in warehouses here in the United States as the company waits for FDA emergency use authorization. Let's verify. Where is AstraZeneca's vaccine in the FDA approval process? Our sources, Dr. William Moss, a vaccines expert from Johns Hopkins University, Dr. Bruce Walker, an immunology expert from the Harvard Medical School, and the FDA. According to the FDA, the approval process hasn't started because AstraZeneca hasn't applied yet.
There's an ongoing trial in the U.S. that should be reading out soon, where thousands and thousands of people have been tested with the AstraZeneca vaccine.
The FDA requires that at least half of the participants have 2 months of follow-up. That's what they required for J&J and Pfizer and Moderna.
If you recall, that final study is called the Phase 3 trial.
The company needs to kind of put all that together, all those data together, and present it to the FDA.
Both of our experts point to April as a time when AstraZeneca will apply for FDA approval. However, a situation in Europe has added another wrinkle.
The AstraZeneca vaccine right now is on hold in many countries in Europe because of concerns about whether it may be associated with blood clotting disorders.
I think the FDA would be remiss if they didn't, look at what's coming out of Europe.
As it stands, in the United States, we're still several weeks away from seeing AstraZeneca apply for FDA approval, and it might hinge on what European health experts report. With your Verify, I'm Matt Gregory.